Welcome to the Printing Armbands and Labels for the MART e-learning course. Before we get started, if for any reason throughout the course of this lesson you need to return to this slide, simply select the Home button in the bottom left-hand corner. To advance through this lesson, select the Next button. Let's go ahead and begin by selecting Next. Printing armbands and labels is a crucial step to arriving patients at the MART, as this allows clinical staff to provide safe and accurate treatment. At time of arrival, the patient meets with the patient access representative to be arrived. In some cases, a full registration must be completed. Upon arriving the patient, armbands will print to the registrar, who will place the band on the patient, and labels will be sent to the respective location. Upon the patient's first arrival, these armbands and labels will print automatically after they have been registered. If a patient has a recurring encounter for medical oncology or pediatric oncology, a patient access representative is responsible for manually printing armbands and labels each time the patient arrives for their treatment. By the end of this e-learning, you will know the process for manually printing armbands and labels for recurring MOD-K and PDON encounters within MART. It is the policy of Stony Brook Medicine that the first-line personnel who work with patients directly are responsible for patient identification. For example, in the emergency department at triage, a nurse acts as the first-line personnel that places the armband on the patient. However, at ambulatory surgery and the cancer center or MART, the patient access representative will be responsible for placing the armband on the patient, as they are the first-line personnel at the time of arrival. After selecting Complete when a patient has been arrived, labels will automatically be sent to the respective locations, and armbands will be printed to the patient access representative. At this time, the patient access representative will band the patient. If a patient has a recurring encounter for medical oncology or pediatric oncology, the first visit of the month will automatically print the same way. However, each subsequent visit will require the armband and labels to be manually printed. To print armbands and labels for the patient's recurring encounter after the initial arrival, be sure to copy the encounter number, also known as the account number, to search for the patient prior to printing documents. Printing documents will be accessed by the patient access representative either through PM Office, utilizing the Run Documents icon, or through PowerChart. For this e-learning, we will be demonstrating these functions through PowerChart. Located in the top portion of PowerChart, begin by selecting Documents. If the Documents button is not labeled at the top, you will need to select the ellipsis to locate this. In the Documents window, select the Find Person icon. This will bring up the person search. Search by the patient's encounter number that was recorded after arrival, as this ensures that labels and armbands are printed for the appropriate visit. If the encounter number was not documented, be sure to follow the standard patient search criteria to find the correct patient and encounter. As a reminder, it is crucial that the correct patient is selected, as that patient's information is what prints on the armbands and labels. Once the patient is found, select the appropriate recurring encounter and click OK. Confirm that the patient you selected is correct. Once confirmed, under Qualified Documents, select the appropriate option that you wish to print. To print a label, select Standard ACP Armband with BB. In order to manually print an armband, you will select Single Armband. For purposes of this demonstration, we will select Single Armband. At the top of the Documents window, select the Print Document icon. From the drop-down, locate and select the appropriate printer you wish to print to. Click OK, and the armband will print to the respective printer for the patient access representative, and the labels, depending on which printer is selected, will be sent to the appropriate location. Once the band is printed, the patient access representative will proceed to band the patient. An adult armband will be utilized for both adult and pediatric patients. Though there is no preferred arm to place the band, it is important that the patient access representative use their judgment to determine what is comfortable for the patient. When doing this, be mindful of the patient's sensitivity to the band or conditions that may affect the placement. For example, if a patient has lymphoma, swelling may occur and the band may not fit properly. As mentioned earlier, once the band is printed, the information listed should be reviewed for accuracy. Select the option you would utilize to search for a patient in order to print their armband and select Submit. Select the option you would utilize to manually print an armband and select Submit. Select the option you would utilize to manually print a label and select Submit. This concludes the e-learning on printing armbands and labels for the MART. Thank you from the Patient Access Department. See you at the next lesson.